kids, I'm HIV, human immunodeficiency virus. I'm a virus that weakens the immune system by destroying cells that fight disease and infection, and I can lead to AIDS, acquired immunodeficiency syndrome, which is a life-threatening illness at the final stages of HIV. There's no cure for me right now, but with proper medical care, I can be kept at bay. HIV is spread 3 different ways. The first is through genital fluids, like through sexual intercourse. The second is through blood, like if you use a syringe that somebody with HIV already used, or if you get a blood donation from them. And the third is through breast milk, like nursing children. AIDS has existed in North America since about the 1960s, but it wasn't recognized as an epidemic until the 80s. In 1995, AIDS was the leading cause of death among people 25 to 44 years old. And since the late 1990s, there are about 40,000 new infections of HIV every year. Originally, people believed that only certain people were at risk for HIV. They were called the 4-H Club. Hemophiliacs, people with abnormal bleeding who received contaminated blood donations.
Homosexual men who reported higher incidences of the disease.
Heroin users and people who use injection drugs. Haitians, or people of Haitian origin. Many cases of AIDS were reported in Haiti. But HIV can affect anyone regardless of sexual orientation, ethnicity, gender, or age. Still, certain groups are at higher risk for HIV. Gay and bisexual men are the population most affected by HIV in the United States. In 2017, gay and bisexual men made up 70% of the new HIV diagnoses in the United States. And despite being only 12% of the national population, Black people account for 43% of new HIV diagnoses. New HIV infections of gay Hispanic men have increased 18% from 2011 to 2015 due to lack of health insurance and miscommunication that limits their access to medical services.
¿Podrías ayudar con mi salud sexual? I don't speak español.
Currently, people with HIV can be on antiretroviral therapy, which brings HIV to undetectable levels in the blood, so they can't transmit it to a partner. Medical professionals say undetectable equals untransmittable. However, this year, 2019, about 1.1 million people in the U.S. are living with HIV. About 1 in 7 don't know they have HIV.
Since the 80s, there's been a general rise in the federal funding for HIV because of the increasing number of people living with HIV in the USA, which has led to increased spending on care and treatment. In 1982, funding was a few $100,000 for research. Now, in 2019, it has increased to $35 billion.
In 1985, President Ronald Reagan called AIDS research a top priority of his. President Clinton hosted the first White House HIV and AIDS conference and demanded for a vaccine research center. This center later opened in 1999. The Center for Disease Control and Prevention is in charge of HIV research and prevention in the United States. The National HIV/AIDS Strategy seeks to lower yearly infections and increase HIV medical care. There are daily pills for people at high risk of getting HIV or for people who have HIV to prevent from spreading it. The NHAS vision. The United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have access to high-quality, life-extending care, free from stigma and discrimination. U.S. blood banks used to not test blood for HIV. When they started doing so in 1985, men who had sex with men were banned from donating blood. In 2015, this was changed so that they could give blood if they have not had sexual contact with another man for at least 1 year. HIV stigma and discrimination refer to negative attitudes and unfair treatment toward people with HIV. These can make people with HIV feel ashamed, alone, and depressed. Some states convict people with HIV for things that can't spread HIV, like spitting or biting.
I'm not gonna get infected by your HIV, am I?
John's a drug addict. He deserves to have HIV.
I have to tell you something. I have HIV.
What's wrong with you? You should have dated someone who's already sick.
Izzy shouldn't participate in the company potluck because she has HIV.
The truth is, HIV is not transmitted through casual contact. There has been no documented case of HIV being spread to a close family member, even after long periods of time using the same bathrooms, sharing eating utensils, and hugging and kissing. Youth with HIV are the least likely of any age group to get the medical care they need quickly. Young people deserve access to information and tools they need to reduce their risk and get treatment and care if they have HIV. In the 80s, students with HIV were targets of protests and death threats. Laws have been passed to allow HIV-positive children to attend public schools without sharing their HIV status, but we also don't want them to miss out on support for their emotional, social, educational, and medical needs by caring and informed classroom communities. Think about it. What would you do if you found out that your classmate had HIV?